Is President Trump planning to do to help seniors this year? Well, I have details of 10 proposals in front of the president to help improve the lives of seniors this year. And then still to the end of this video, because I have breaking news. This may be the last time you ever get any mail from the Social Security Administration, because they are eliminating their communications department and moving all communications to the public to Twitter, or what is now known as X. So basically, they're going to force seniors to go on social media, specifically on X, to find out any changes that are happening with their Social Security or Medicare benefits. I'm going to talk all about it. My name is Kwame Kwade. I am a personal finance expert and I am an entrepreneur. For 15 years, I have been creating content to help seniors get the benefits they deserve. We started with websites. We have numerous websites on Social Security, food stamps, Medicare, and Medicare. Now we are deep into creating video content. I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button, because we do appreciate your support. And as always, before we start any broadcast, I want to know where you are watching this video from. Go in the comments and let me know your city and your state. So let's dig in. So Trump has a plan to help seniors, and there's 10 proposals that have been put in front of the president from various sources to try and improve the life of seniors in 2025. Let's talk about it. Why is the president even concerned about helping seniors? Well, seniors are a big force in this country. Seniors consistently have the highest voter turnout, with 74% of people age 65 plus voting in the 2020 election. They made up over 30% of the electorate in recent election, shaping outcomes in key swing states. Economically, seniors are a powerful force. People age 50 plus contribute 56 cents of every dollar spent in the US, a figure projected to grow to 61 cents by 2050. Their spending drives job creation, supporting over 88 million jobs in 2018. Now, there's also an entrepreneurial impact. Seniors are increasingly entrepreneurial, with 25% of new businesses started by individuals between the ages of 55 and 64 in 2018, up from 15% 2 decades ago. And then there are things that seniors do that they don't get paid for but contribute a lot to the economy. Older adults contribute $745 billion annually through unpaid caregiving and volunteer work, bolstering the economy and communities nationwide, which is all of these reasons why the president is focused on programs and initiatives that will help improve the lives of seniors this year in 2025. Here are the 10 top proposals that are being put in front of the president. The first one is, of course, what he campaigned on, to eliminate taxes on Social Security and also cut taxes. So eliminate federal income taxes on benefits. Removing federal taxes on Social Security benefits will allow retirees to retain more of their income. Currently, up to 85% of benefits are taxed for higher income retirees, generating vital revenue for the Social Security Trust Fund. Then there's also COLA, cost of living adjustment, which has historically been low. It's a place that the president can provide some relief to seniors right away. Adjusting COLA to match inflation ensures seniors maintain their purchasing power. In 2025, a 2.5% COLA increased benefits by a mere $50 a month for 72.5 million Americans that are on Social Security and disability benefits. And then another key area that the president could really help improve the lives of seniors is to investigate fraud. Addressing improper payments and fraud could save billions annually, which could also help extend the life of Social Security benefits. Between 2015 and 2022, the Social Security Administration paid $72 billion in improper payments. And then another thing that the president can do is raise the income threshold. Increasing income thresholds for benefit taxation, it means that the income that is subject to Social Security taxes would protect middle income retirees from excessive tax burdens, ensuring equitable relief. Another thing is expanding Medicare coverage. Seniors spend an average of $4,096 annually out of pocket for healthcare costs, with prescription drugs being a major expense. Expanding the Inflation Reduction Act's 35 a month insulin cap to all medications could save seniors hundreds annually. Could also expand preventative care. Preventative services like cancer screening and vaccination reduce long-term healthcare costs and improve outcomes. Expanding medical coverage for dental, vision, and hearing could address unmet needs for 75% of seniors who lack this coverage. Remember, Medicare does not cover these. And so you have to get your own private insurance to cover them. If the government adds that to Medicare, then 75% of seniors who currently do not have this coverage would then get it. And then supporting long-term care. Over 70% of Americans age 65 will need some form of long-term care, but Medicare does not currently cover long-term care. Including limited long-term care coverage in Medicare Advantage plans will reduce financial strain on families and seniors. So Advantage plans could be a place that seniors could be helped by requiring some limited long-term care coverage, and then limiting out-of-pocket costs for Medicare. Medicare beneficiaries currently face unlimited out-of-pocket expenses for Part A and Part B services. Implementing a $5,000 annual cap will protect seniors from financial hardships during serious illness and hospitalization. Number 3, strengthening Medicaid for seniors. Now, a lot of people don't know, but a lot of seniors on Medicare are also on Medicaid because they don't have the money to afford the high costs, out-of-pocket costs, co-pays, deductibles, etc., and premiums that comes with Medicare. So Medicaid helps 30% of seniors pay for that. So strengthening Medicaid for seniors is important. Medicaid funds care for 62% of all nursing home residents. Did you know that? 62% of all nursing home residents are paid for by Medicaid. And so when Congress is talking about gutting Medicaid, they're actually doing it right now. They just passed a bill in the House and Senate to gut $880 billion from Medicaid. Is going to impact seniors, especially those in nursing homes, disproportionately. So protecting Medicaid ensures seniors have access to affordable long-term care facilities. Over 80% of seniors prefer aging at home, but Medicaid funding for home care is limited. Increasing funding could reduce institutionalization cost by up to $9,000 per year per individual. And then improving eligibility. Currently, only seniors earning less than $2,742 a month qualify for Medicaid long-term care services. Simplifying eligibility rules could help more low-income seniors get this vital health care. And then prevent federal spending caps. Federal spending caps on Medicaid could lead to $1 trillion reduction in benefits over the next decade, jeopardizing care for vulnerable seniors. So when you hear all these discussion in Congress about cutting Medicaid, this is important healthcare for seniors. And then another place the president can help is addressing housing challenges. Nearly 10 million seniors spend more than 30% of their income on housing costs. Expanding programs like senior or Section 202 supportive housing for elderly could provide relief for thousands and thousands of seniors. Integrating healthcare and social services into senior housing reduces hospitalization by 25% and improves overall well-being. That's why coordinating housing with services is vital. Another place the president can help is expanding rental assistance programs. Only 1 in 4 eligible seniors receive rental assistance due to funding shortages. Increasing funding could help an additional 2 million low-income seniors afford stable housing. And then promote aging in place initiatives. As I mentioned, 80% of seniors want to age in place. So home modifications like ramps and grab bars cost an average of $2,500 but can prevent falls that result in $50 billion in annual healthcare costs. Another area the president can make a big impact on seniors this year is reduce healthcare inequalities. Rural seniors face significant barriers to healthcare, with 20% living in more than 30 miles from a hospital. Investing in telehealth infrastructure can bridge this gap and improve outcomes. And then streamlining enrollment processes. Nearly 3 million eligible seniors are not enrolled in Medicaid because of complex application processes. Simplifying enrollment could ensure timely access to care for these individuals, and then providing culturally competent care. Minority seniors experience higher rates of chronic illness like diabetes and hypertension. Training providers on cultural competency can reduce disparity and improve health outcomes. And then support behavioral health services. 1 in 4 seniors struggle with mental health issues, yet only 3% of Medicare spending goes towards behavioral health services. Expanding coverage could address this growing problem. And then one major area the president can help is drive down drug prices. Allowing Medicare to negotiate drug prices could save $78 billion annually and reduce out-of-pocket costs for seniors by an average of $5,000 per year. Seniors often face medical bills averaging $750 per incident after hospital stays or procedures. Legislation banning surprise billing would ease financial burden significantly on seniors. And then there's a need to close the coverage gap. The Medicare Part D donut hole forces seniors to pay full price for medications after reaching a coverage limit until catastrophic coverage kicks in. Closing this gap could save millions from high drug costs. And then finally, cap catastrophic costs. Implementing a $2,000 annual out-of-pocket cap for Medicare Part D beneficiaries would protect seniors from financial hardship during serious illness. Then there's long-term care. Probably one of the areas the president can make a big impact is to set minimum staffing requirements. Nursing homes with adequate staff have 30% fewer cases of neglect or abuse. Federal staffing mandates will ensure quality care for residents. And then supporting family caregivers. Over 41 million Americans provide unpaid caregiving for elder adults, saving the government $470 billion annually. Offering stipends or tax credit will support these caregivers financially. And then invest in workforce development. A shortage of elder caregivers is projected to reach 1 million by 2030, which is not a long time away. Increasing wages and training opportunities will attract skilled workers to this field. And then monitoring nursing home quality. Strengthening oversight through surprise inspections has resulted or reduced violations by 15%. Expanding these efforts ensures nursing home facilities are safe and can operate safely to support seniors. Another area the president could really help improve the lives of seniors is to boost retirement savings. One way is to increase contribution limits. Raising IRA contribution limits from $7,500 to $10,000 annually could help older Americans save more as they approach retirement age. And then promote employer matching. This has really been going away over the years. Only half of private sector workers have access to retirement plans with employer matching contribution. Expanding these programs could significantly boost saving rates among older employees. And then financial education. Nearly 1/3 of Americans age 55 have no retirement savings at all. 1/3. Providing free financial literacy programs can help seniors better plan for retirement and reduce reliance on Social Security alone. Remember, Social Security was not meant to be your only retirement option, but now it is for 40% of seniors. And then expand tax incentives for saving, offering additional tax breaks for contributions to retirement accounts, encourage savings, and ease financial burdens. Then there is elder abuse, another area that legislation and the president can support to keep seniors safe. Elder abuse affects 1 in 10 Americans age 60 plus, yet only 1/3 of cases are reported due to lack of awareness or fear of retribution or retaliation. Strengthening laws against exploitation safeguard vulnerable seniors from harm. And then improving the reporting system, simplifying abuse reporting mechanisms through hotlines or online portals ensure timely intervention and justice for affected individuals while increasing reporting rates by up to 20%. And then educating seniors on scams. That has become a growing problem and needs immediate attention. Older adults lose about $3 billion annually to financial scams targeting their savings or benefits. Providing educational resources will empower them to recognize fraudulent schemes early and avoid them. And then fund prevention programs, allocating resources towards prevention initiatives like caregiver training reduces instances of elder abuse and neglect across communities nationwide. And then enhancing community support. A lot of seniors are lonely right now because they don't have the community support around them. So investing in accessible transportation, walkable neighborhoods, and senior-friendly public spaces reduces isolation and improves mobility for older Americans. Senior centers provide meals, wellness programs, and social initiatives or activities that combat loneliness among elderly population. Currently, 1/3 of all seniors in the US are lonely, and that's a big problem and leads to rapid decline and even death because of isolation. And then support volunteer networks, mobilizing volunteers through programs like RSVP, Retired Seniors Volunteer Program, helps address critical needs such as companionship and transportation assistance for isolated seniors. And then finally, promoting intergenerational programs, initiatives that connect younger Americans with older adults, improve mental health outcomes while fostering community bonds. And then Doge has been the news, and protecting seniors from Doge it's something that is actually immediately within the president's reach that he can do. It doesn't require Congress because this is his initiative. The Department of Government Efficiency has proposed cuts that will reduce SSA, Social Security Administration, regional staff by 90%. And I'm going to talk about that in a second regarding why you may not get any mail from the Social Security Administration anymore, leading to longer wait times and reduced access to senior services. Doge-driven policies risk undermining Social Security and Medicare, programs that provide more than half of income for nearly 40% of seniors. Protecting these benefits is critical for economic security. And then healthcare access, cuts to Medicaid, which I've talked about, and this is serious, could jeopardize nursing home care for 2/3 of residents who rely on it, leaving vulnerable population with essential supports that they need that they now cannot get. And then policymakers must prioritize safeguarding senior programs from budget reductions to ensure older Americans can age with dignity while enjoying the services that they've earned and paid into and are expecting during retirement. All right, so let me know what you think about these 10 proposals in front of the president to help seniors. Which one do you think he should prioritize? Let me know in the comment section below. I want to hear your thoughts about all of this. And then let's dig into why Social Security is forcing seniors to go on X, formerly known as Twitter, to find out information about Social Security because they are eliminating their communications department. Let's talk about it. The Social Security Administration will use Elon Musk's X platform for public announcement, replacing press releases and Dear Colleague letters. This shift aims to modernize communication but raise concerns about accessibility for seniors. Only 7% of X's news consumers are age 65. So only 7% of seniors are going on Twitter to find or consume news. And so why is the Social Security Administration sending seniors to a platform that they don't use? SSA staffs are encouraged to follow X on social media, marking a significant shift in internal communication. So even those who are working at the Social Security Administration have to follow X to hear about things that are happening in their own organization. That's crazy. Critics, including Senator Warren and Wyden, have voiced concern about transparency and potential conflict of interest due to Musk's ownership of X. I mean, you can see this written all over. Elon Musk has a lot of government contracts, and he's making people believe that all this Doge stuff is altruistic. Meanwhile, at the back, he's also benefiting from the services that he's eliminating or canceling. They're cutting workforce, which is going to impact services to you. The SSA plans to lay off 12% of its workforce from 57,000 to 50,000, impacting the 70 million people that get benefits. 26 regional offices are slated to close this year, further limiting in-person services, meaning that some seniors have to travel miles and miles and miles to get to the nearest office. And then wait times are now long, and then efficiency is decreasing. All of that is a mess and getting worse because Doge is there running rampant, touching things and touching everything and eliminating things that probably shouldn't, like eliminating the communications department that sends letters and communicates with the public about social security changes and forcing seniors to go online to get that information on a social media platform and not on the social security website. That is bizarre. Seniors unfamiliar with social media may struggle with the transition to X, risking missing updates about benefits and services. Increased reliance on online portals has led to system crashes, with 4 outages reported in the last month alone. New anti-fraud measures require in-person visit for anomalies in direct deposit changes, complicating access to beneficiaries. And then advocacy group worry that discontinuing the Dear Colleague letters, the letters you're getting in the mail that informs you about what's happening, will hinder outreach efforts for vulnerable populations. While some view shift to X as modernization, others worry about alienating seniors who rely on traditional methods like mail to get information about Social Security benefits. The move has sparked debate over Musk's involvement in government operations and potential conflict of interest. Senators and advocacy groups have established a war room to counteract SSA's changes and protect beneficiary rights. Critics warn that these changes could undermine SSA's ability to serve its growing beneficiary base effectively, being able to serve their population that they have been charged to do. So let me know what you think about the changes. Do you think that the Social Security Administration should move all communication to X from their website and from mailing letters to you and forcing everybody to go on Elon Musk's platform, which is shamelessly a big conflict of interest? You know, you cannot come into the Social Security Administration, eliminate and cut staff, cut workforce, cut services, eliminate phone services, gut the communication department, and tell everybody to come to your website, your platform, to get news about Social Security. It's a big red flag and a huge conflict of interest if there is ever one. So I don't think it's a good idea. I don't think a lot of seniors spend time on X to get their news. And so why are you pushing people to go on your platform to get news about a government service that has been working fine until you came and gutted the communications department? Anyway, let me know your comments or your thoughts about all of this. If you're turning 65, pay attention. If you're on Medicare, pay attention even more, because there's a lot of news happening around Medicare. A lot of you are being dropped from your plans, or your coverage is being dropped, your doctor is being dropped, or the medications that you were relying on is no longer covered. There's so much happening and it's all over the news. And I've been trying to figure out how can we help to make sure that you are on the right Medicare plan, and that if you're not on the right plan, you can switch to a better plan that serves your needs. Well, here's the thing. There are 24,000 Medicare plans out there, and only in a particular area, you as the senior have to figure out what plan works for you, works for your coverage that you need, works for your budget, your doctor network, and the coverage that you need. And all of that can be challenging because there's 24,000 plans out there. And 90% of seniors are in the wrong Medicare plan as a result. And it's costing money and also costing people their health, because when they need the services, then they find out that they don't have it or are not covered. And so we have partnered with a Medicare advisory company, a free service to you, but can make a big difference in your coverage and accessing the right coverage that fits your need. Chapter Medicare services are free, it's unbiased, and they are the only Medicare advisory company with access to all 24,000 Medicare plans. And one of the biggest reasons why we are partnering with them is because their licensed agents do not work for commission. So when you call Chapter and you're working with them They are not there to sell you the most expensive plan. They have access to all 24,000 plans. They can look at your local area and find out what plan meets your need, your budget, and the services that you need and the coverage that you need. And they can save you about $1,100 a year. So call them now, 539-205-2147. Let them know that we sent you from Benefits Insider, and you have to call now because there may be a small window for you to be able to change the plan that you're on. And if you're turning 65, there is a window for you to get on Medicare. It's 3 months before you turn 65 and then 3 months after. So that window could be closing, but Chapter can help you find the best plan that meets your need. They're highly rated, A+ from the Better Business Bureau, lots and lots and lots of 5-star reviews online. Check them out, call them at the number, or go into the description to this video or the comment section. I'm going to put a link there. If you don't want to call, you can fill out the form right now, and then they will reach out to you and help you get on the best plan that meets your needs. Now, as I mentioned, 90% of all seniors are in the wrong Medicare plan. These guys can help you fix that. So I hope you like the content that I brought to you today. Let me know your thoughts in the comment section below. We also launched a membership. If you want to support our work and get exclusive member services, check out our membership in the link on our page. Thank you for spending this Sunday afternoon, evening with me, and I'll see you in the next video tomorrow.